What is up, guys? Welcome back to the channel. On this episode, I'm going to be giving you an update of what happened since the past 2 weeks since my skin removal surgery. I hope you enjoy. What up, guys? It is June 25th. We're 13 days now post-op, and I'm feeling pretty good. I'm a little worried. Today is going to be a pretty busy day. We're getting ready to go out and go shopping at Costco, and we're going to go to an event later on tonight that's going to be outdoors. So I'm kind of curious to see what's going to happen. Really haven't done too much at this point. So today's gonna be a pretty busy day. My back pain is still there. I'm just trying to rest and relax, but I think I probably need to get out and start doing some activities to kind of loosen everything up and make everything start work again. I don't want to baby it too much, so I'll check back in with you guys tomorrow and let you know how it goes. Alright, guys, so it's June 26th now, day 14. I actually feel pretty good. So we had a super busy day yesterday. We went to Costco. It was a whole bunch of walking and not really having much rest. And I actually feel really good. My drain port's pushed out a little bit more than normal today, and I think that's just due to the increased activity that I had yesterday. My back doesn't hurt nearly as much as it did a day and a half ago. So I'm actually pretty surprised, to be honest with you. I didn't think that I was going to feel this good. Like I really, this is kind of like a tables turning kind of thing. I really thought I was going to be in rough shape. I was going to regret every minute of it. And I don't regret a bit of it. I did get a little hot when we were outside. There wasn't too much area for shade. We were sitting in bleachers at a stadium. There was a little bit of discomfort there with sitting on the bleachers, but I was trying to like arch my back backwards to kind of alleviate some of that abdomen pain. Not so much incision pain, but more abdomen pain. So really what I'm really having issues with right now is the binder area. So everywhere that the binder is, I don't know if it's just like friction. I'm not really sure what it is, but there's like, I run my hands over my skin and it just like pins and needles and it just hurts. So all in all, pretty decent. Can't complain. Like I said, there's no incision pain. The drains are still pushing out liquid. We're probably right around 100 cc's a day for each side, maybe a little bit less, but average is about 100 cc's a day for that. So I just want to go over some quick things real quick about what you can do while you're at home recovering from surgery that'll help you to pass the time by. Some of the things that I do, I got these word search puzzles and some Seaside Escape coloring books. You know, they're texturized. So I'm doing a lot of coloring. I'm doing a lot of word searches. I'm actually feeling like an old person right now because I'm sitting down doing my word searches and the next thing you know, I'm just dozing off and waking up and starting them all over again. So I guess I see what my future is going to look like here in the next couple years. Some other things I really try to focus on is getting my water intake in. I always have this thing full. It's full of water. Sometimes, like I told you guys before, I just get sick of the water. So there's some different things that you can do to supplement your water intake, okay? One of the other things I like to do, I like Propel. Propel is one of my number one go-to drinks even just after VSG surgery, not just so much just this post-skin removal surgery, but in general, I usually have Propel with me. If not, I'll have a Gatorade Zero. I'll have the Zero Powerade. Those are pretty much my 3 go-to drinks other than actual water. Now, some other things I do like to add to my water is the liquid IV. I personally like the lemon lime or the watermelon flavor. So sometimes when I fill this container up right here, I'll just dump 1 packet of water. It helps get extra electrolytes and stuff like that, and just gives it that flavor that isn't just water. So I really like it. Another thing that I do also is I've been adding Juven, their therapeutic nutrition powder for wound healing. So this one is orange and this one's fruit punch. I've been having 2 servings a day of these. I'll have 1 in the morning and 1 at night. It's supposed to help for wound recovery. If it does or doesn't, I'm not really sure. I'm hoping it does, and maybe that's why I'm feeling the way I'm feeling. But this has collagen protein in it, and it's really supposed to help, just for your wound recovery. I'm trying to get back up and on my feet and back to work as soon as possible. So hopefully this is going to help. Juven stuff is a little bit expensive, especially when you're drinking 2 of them a day. But in the long term, if it gets me back to work faster, I'm okay with that. And obviously, you always want to make sure that you're continuing to take all the prescribed medication. Okay, I have antibiotics, I have Tylenol, I have the stool softener, even though I don't need that much anymore. And I also have my muscle cramp pain as well. And to go along with that, you also need to make sure that you are taking all of your vitamins, right? Because we're still having weight loss surgery. We're still going to be vitamin deficient. So I've tried a lot of vitamins since surgery, and a lot of them really affected my stomach. Swallowing pills after surgery can kind of be a task. It makes you feel sick. So I decided to go with the Berry Melts. Okay, so I take the Berry Melts multivitamin. I take the B1, and I also take biotin. So they're all dissolvable pills, is why I like it. Because I don't get that full feeling afterwards. I just plop the pill in my mouth, it dissolves, and I go about my business. So another vitamin that I take is D3 and K2. That's going to help with your teeth. They're going to start building your teeth back up and getting the calcium and everything else that you need within your teeth. My dentist recommended doing that because I was getting a lot of cavities right after surgery. And since I've implemented this into my regimen, I haven't had any cavities since then. So just wanted to update you guys with that. So it is super important that you keep yourself busy. I find myself getting off track a little bit because I am just sitting in a recliner watching movies. I'm doing little busy work here and there, but I'm also finding myself getting up and walking to the kitchen and trying to eat something even though I don't need it necessarily. I may want it, but I don't really need it. So mindful eating is a huge part in this because you are bored. There are times I'm just sitting on the couch and I'm probably a little depressed. I want to get out and go do stuff. I want to go back to work. I want to go do other things. I want to start working out. I've been looking at different workout plans to do for after I'm all healed up. And now my body's just kind of chomping at the bit to go. So, there's other things that you can do. I'm doing a little bit of work from home. I'm starting to design a remodel for the back of our house for our patio. So I'm trying to find things just to occupy my mind so I'm not so focused on me being bored and me just going to the kitchen to eat just because I want to eat. So you really have to just concentrate and focus on just having things to occupy. And so that's why I do the little coloring books, the word searches, everything else. It just helps to kind of interrupt that thought process of I need to eat. So I'm going to update you guys in a couple more days. We're 2 days away from my 2-week post-op appointment. So I'm curious to see what they're going to say. I want to see how everything's healing up. Like I was saying before, I'm not really feeling any incision pain whatsoever. Everything else is kind of, I'm thinking, is more along the lines of binder pain because of the constant rubbing and irritation. I have been putting creams and stuff on my belly to hopefully mitigate that. I tried putting a pillow sheet in between the binder and my skin. However, it just doesn't hold as tight when you're walking around and stuff. It really starts to lose. So at night, I've also been taking the binder off for maybe about a half an hour, 45 minutes, just to kind of give my belly a break. So everything just seems to be going in the right direction. So I'll check back in a couple days when we go for my 2-week post-op appointment. All right, guys, it's day 17. Just got back from my 2-week post-op appointment with the doctor. They took all the bandages off and everything else, and they looked around and they said everything looks great. Everything's tracking to where it should be, and the belly button looks good. The drainage on the right side currently only pushed out about 5 cc's today. So there's a significant difference in the drainage. He thinks there may be something clogging that up. We're not sure. We won't know. Both drain ports are still in, with the hope that it starts clearing up this week for next Tuesday, that I can at least get one of them removed, which would be great, and we're heading in the right direction. The left one today, it's pushed out about 100 cc's. So the left one was really low for a while. Now it's back up. So I'm not really sure what's going on, but like I said, he said he thinks everything is going great. Everything's moving in the right direction. So he sent me home without the sterile dressing over my bandage. So right now, everything is just skin on skin at this point. Makes me a little bit nervous. I'm not really sure. I don't know. It just makes me nervous. So what I'm going to do for you guys is I'm going to shoot up on the screen 1 week ago what it looked like, and then now, just to kind of compare to see how it's moving, how it's tracking, and everything's going in that direction. Also, the bruising, if you guys remember me talking about it, the bruising for the drain ports on each side has significantly went down as well. So the black and blues are no longer black and blue. It's for the most part completely normal. So some things I was asking him during the appointment was, now that we're not going to have dressings over the bandages, at what point in time do I start to, do some kind of wound care as far as like scarring goes? Because obviously I don't want a huge scar along, my abdomen line where it's going to be completely noticeable that I had the surgery. So I wanted to kind of see like, what should I start looking at? I've been online in some of these groups saying that, I put this ointment on and this and that and this. So luckily this surgeon was actually, prior to being a bariatric surgeon, was a plastic surgeon. So who better to ask than someone that's already in the game? So he's been in it for a while, and he said, they did a study about it, and they have shown that just simple massaging and staying out of the sun helps to reduce the risk of scarring. Okay, so if you start going out in the sun right after surgery, it's going to start bleaching that line, and that's not what you want, because then it's very distinguishable against where your incision line was and where your skin is. So it's super simple, right? So it's just massaging the area. A couple more weeks, not yet. I don't really want to touch it right now. Even though I touch it, I don't really feel it. But another couple weeks, once everything starts healing more, I'm going to give it some gentle massages, just kind of work that tissue, just trying to give all the nerve endings and everything, just kind of trying to wake them up and come back to life, so we can kind of start this healing process. So next Tuesday will be 3 weeks post-op appointment. I'm super excited. They didn't take my weight today, so I know when I got on the scale the other day here at the house, I was 276. So we're still trending in that right direction. I'm not really getting hyper focused on the weight loss currently, because I know I still have bloating and other things are going on. So all in all, everything is looking great. Everything is moving in the right direction. I have to kind of get over it this week, that I'm not going to have that extra protective barrier between my skin and my garments or whatever else I'm wearing. So I really hope that you guys are enjoying the content. It's really helping me to stay on track, and if I can help anyone that's watching this video to try and make the decision to go through weight loss surgery, for the ones that have already went through weight loss surgery, to get the panniculectomy surgery or a tummy tuck or some other thing, just know that it's okay. It's part of your journey, and that through this process you are changing your whole life and everything that you're doing. So if you guys haven't already, like, comment, share, subscribe. I greatly appreciate everyone that's reached out to me. And until next time, guys, have a great day.